Hey guys, I'm Dr. Jamal. Today we're going to talk about fish oils and what the science shows. If you like this content, please don't forget to share and subscribe. Give me a thumbs up. This helps me build my channel. So let's go ahead and jump on in. Okay, most of us have heard that fish oil is good for the body. It's good for the cholesterol. It helps with triglycerides, and in turn is supposed to help with heart attacks and strokes and other cardiovascular death. Before we talk about fish oils, let's talk about omega-3 fatty acids. Now, there's three types of fatty acids. We have the ALA, which are derived in plants. Then we have the DHA and the EPA, which are found in fatty fish. Earlier studies showed that populations that were primarily consuming a diet in fatty fish were found to have fewer cardiovascular outcomes like stroke, heart attack, and death from either of those things. Fish oil is very rich in EPA and DHA fatty acids, and those fatty acids are helpful in the body, such as for brain health, maintaining brain cellular structures, eye health. It's also been found to help with arterial muscles. Remember, arteries take blood from the heart to the body, and the veins take the blood from the body back to the heart. Well, in the arteries, they are lined with muscle, and the fish oils help with muscle relaxation through a variety of chemical means. One of the most important benefits that has been proven many times is that fish oil lowers the triglycerides. The triglycerides are a form of bad cholesterol. There's three main types that I like to focus on with my patients. We've got HDL, which is a good form of cholesterol, LDL, which is a bad form of cholesterol, and then triglycerides is the main one that we are talking about for fish oil. High doses of 3 to 4 grams per day can lower the triglycerides by up to half. However, fish oil doesn't lower LDL cholesterol by much. For doctors, our first choice to tackle LDL cholesterol is statins. For those who have high blood pressure, fish oil has been found to have small reductions. Studies have found that the reduction can be as small as 5 millimeters. What does this mean? Well, that's a tiny drop. But since blood pressures are so risky and hazardous for brain health, for cardiac health, and the rest of the body, a small drop of 5 can go a long way for the development of these diseases. Fish oil has also been linked to inflammation. Here is a list of inflammatory markers. We have a whole bunch that we are aware of and more that we aren't, and fish oil has been shown to reduce the inflammatory markers. The idea here is that with fewer inflammatory markers, we have fewer inflammation. The research on blood sugar in fish oils is mixed. There's a little bit of research that shows fish oils help improve insulin work more effectively by loading up that bloodstream sugar into storage. And this has been seen in pregnant individuals and children, but the effects are not dramatic. There has been some studies to show that there's a modest reduction in feelings of depression and anxiety. Fish oil is currently being studied to see if it can prevent dementia. If you decide to choose fish oil, take a look at the bottle. Look at DHA and EPA quantities per capsule. We are not trying to go more than 3 to 4 grams per day. Try to find medicines that undergo third-party screening and are free from impurities or toxins. The FDA states that we shouldn't be consuming more than 3 grams of fish oil per day. This is combined EPA and DHA. The number one side effect reported is gastrointestinal symptoms or stomach upset. So think of nausea, vomiting, diarrhea, pain, some gas-like pains, and maybe even constipation. Now, there have been reports saying that taking the fish oil with food or even freezing the capsules can help limit or even reduce all these side effects. Let's talk about the limitations of fish oil. So pancreatitis can be a risk, but the data hasn't been very strong as showing whether it is or isn't present. Furthermore, one of the most important trials behind fish oil did have some problems. For example, they had 2 groups of people. One group got the fish oil, but the other group actually got mineral oil. That was supposed to be the group that was being evaluated to see whether or not those effects of cardiovascular death and effects such as heart attacks and stroke were minimized. But they were given mineral oil. And obviously with mineral oil being an oil, it may actually have led for them to have an increased risk of cardiovascular deaths. Furthermore, the REDUCE-IT trial used a purified EPA product called icosapentaethyl. Now, this is a form of EPA, and it was found to show an improvement in cardiovascular outcomes such as heart attacks, strokes, and death. But other studies using other derivatives did not show the same thing. There is another particular study called the STRENGTH trial, which showed no benefit with different formulations. And although the studies have shown that the triglycerides are lowered, there's not a direct link to showing that the lowering of your triglycerides can lead to fewer heart attacks, strokes, and other cardiovascular effects. There were a few reported events of atrial fibrillation, which is a cardiac arrhythmia developing in some of these individuals, but it is very rare and infrequent, and I have yet to see that. Here are our conclusions. Not every cardiac patient is going to need fish oil, but as doctors, our number one choice in lowering bad forms of cholesterol, especially the LDL, will be a statin. That's if you've had a stroke, that's if you've had a heart attack, or if you have a high risk of having either of those things. An LDL target is what we are following, but not every patient can take a statin, especially some of your elderly patients or patients that develop the side effects of the muscle injury and damage. Then at that point, it would be appropriate to suggest a fish oil because it's better than nothing else. In the end, taking a fish oil may actually be beneficial for lowering the cardiovascular risk for developing strokes and heart attacks, and a little bit can go a long way. If you found this content helpful, please share it, please like, please subscribe. This helps me build my channel. I'm here to make medicine make sense.